and the anterior glide, and have you practice all three. So you want to abduct the leg slightly. It's going to be different for everybody, so you're kind of sighting up the leg to see kind of what might be normal for Michael. And then do you internally or externally rotate the leg?
Wait, externally?
Or
wait,
yeah,
the hip or the toe?
external.
The hip. Am I coming here or am I here?
Here.
Yeah, it's internal abduction, right? Hand over hand technique is what I call it, right? So you want to grab whatever, it's like warrior pose in yoga, right? So you want your back foot in one position, you're standing here, and I'm not pulling with my arms. I'm leaning with my body because I can get a lot more force. Like if I pull here versus if I pull here, right? It's different. So internally rotate, abduct, sit back on my heels, right? And that's hip distraction, okay? Cool. Well, why don't we do this one? So, if you want to do a posterior glide of the hip, right? It's more of a scoop motion. So scoop all the way to the edge of the tip. I'm just sweating. All right. So what you're going to do is you're going to put their leg on top of your shoulder. This hand comes down. Be careful of certain things. And you're going to come on the outside of their hip. Right foot is forward because I'm on this side, and the motion is a scoop and pull, right? Now, it's a glide. You don't have to oscillate here because as you pull, you're going to oscillate anyhow, right? Because it's like, right? So, you're going to scoop and pull. And what I usually do is kind of scoop, pull, and then drop my hips. So they get a nice scoop. So it's just like the elbow scoop, except it's a bigger elbow, right? Okay, and then if they lay on their stomach, just put them on their stomach forward. All right, so you're going to bend the knee, slide your hand underneath, right? So you can stand up from this position, and they're going to go into hip extension. Take your pinky side of your hand, you're going to put it right underneath the glutes, lock out your elbow, and push down. That's an anterior glide. All right, so posterior glide is the scoop. Helps with which motion you think? Posterior glides help with flexion in a ball and socket joint. Ball and socket joint, ball and socket joint. Same thing. And anterior glide helps with, if you ever get confused, put your patient in the position, do the mob, and watch how his leg moves. It's coming up towards the ceiling, right? Anterior mob helps with extension. Try those three.